Prenatal care, you might call us the minute you find out you're pregnant, but you're not going to get into care until about 10 weeks, because since we don't do early ultrasound, the only way for us to hear a baby is through doppler, and that cannot happen until 10 to 12 weeks. So we have about a 6-7 month window with you. Typically, you will come in about 10 times in the 6 to 7 months. Originally, you come every 4 weeks, then every 2 weeks, and then every week. You come in at 10 weeks, 10 to 12 weeks, you have your initial labs. That runs you an interval of every 4 weeks until you get to 28 weeks, and then you have your glucose labs, and so then you change to every 2 weeks at that point. And then at 36 weeks, you have your final set of labs to check your hemoglobin, so to check your iron levels, and a couple of other things to get you ready for birth, and that's when you switch to every week. So anytime you have labs, you can expect a change in your intervals of coming to appointments. A prenatal appointment can last anywhere from 10 to 30 minutes. Normally, as the weekly times go on, we're seeing you so often, nothing has changed, baby sounds good, we'll see you next week kind of thing. There's more things that we need to keep an eye on. We need to keep an eye on the baby, the blood pressure, things like that. So at a typical appointment, you would come in and you'll check in at the front desk, and then we'll give you a little cup, just like you would see at an OB office, and they say, go to the bathroom, test your urine. So we're always looking to make sure that your urine looks good, that there's no signs of infection, there's no other worrisome things in your urine. And then you take a little step over to our intake office, and so where they do your blood pressure, your heart rate, and ask you just common pregnancy discomfort questions so that the midwife has an idea of maybe what to tackle during your visit. And so then you'll come see a midwife. Part of prenatal care is to get to know you so that you don't have a stranger at your birth. And there's a midwife that you might enjoy more than the other just because your personalities click, but our goal is that you don't have any strangers at your birth. So you will know every single midwife in our practice and every single assistant, everyone that could potentially show up, you will know. So you'll have those contact points at every appointment. And so during your appointment, the midwife will chat with you, ask you, is your baby moving? How's it going? Any discomforts, any complaints, any worrisome things that have come up in the last 4 weeks, 2 weeks, or within the last week. We measure, we listen to your baby, and then we send you on your way. So it's a very reassuring appointment because you should walk out of there feeling like everything is well. And if everything is not well, you will have a care plan of what happens next.